project is about 18,000 square feet of interior tenant fit-out, and it's the future home of the main site of the Grand River CHC. We're just moving next door from where the interim site is currently right here, and it's literally just next door. The construction is halfway through currently, and the process is going very well. We have an amazing contractor. We're going to walk through the construction process to show some of the things that are being transformed. We're in the main vestibule of the primary entry, and the main vestibule comes into the clinic, and there's a main ramp that joins essentially all of the levels into the rest of the community area, as well as the courtyard and the entry lobby. One of the fantastic things about this entry, where it's located, is that it's right across from the church. And so if you turn around, there's this beautiful view that the public will get of this church. And when there's a roof on here, the focus will be, there's some writing in one of the windows, and it says, "I was glad when." And we think that's just kind of neat, to carry on a conversation like that. So we're going to enter into the building, and there'll be a roof here, one-story roof. As soon as we come in, we're going to see all the natural light that comes in from the courtyard for how we're seeing it now. The courtyard, we see it as the internal heart and soul of the architecture because of the natural light, because of the landscaping that's going to be there, and that's a public space. So if someone has family who are in a meeting room or a counseling room or an exam room, other members of that family could wait for them in the courtyard if they choose so, or if they can also wait into the entry lobby too. So there's a really nice variety of spaces for the public to be in. Here we are in the entry lobby. This is the reception area, and the public will be seated here while waiting for staff to come and receive them into exam rooms or counseling. There's a child play area over here, which will be kind of sectioned off for a little bit of sound privacy. There's an internet access area for health sites access over here by the public. This is where the reception desk is going to be. Medical secretaries, triage and behind medical secretaries, and over here public washrooms, and in the far right corner is a main corridor which leads into the exam rooms. And here, all of the studying we see, those are the 6 exam rooms. The first 6 exam rooms we see in the block. And then behind me is the temporary enclosures of the openings, which will allow visual sight and light into the courtyard. That's all that for the public and for the secretary. The oral health suite, and there's an entry into the suite. On either side of the entry, there's an operatory room 1, operatory room 2. That's just another word for saying exam room. And then behind over here, we have a lab. That's a dedicated lab for the oral health suite.
Where are we here?
Here we are in the eastern part of the building. It's the last corridor that we'll experience. It's a community space that's accessible from the rear entry. As we're going to walk along here, we're walking north toward the Colburn Street area. The end of the corridor is the CCAC suite. There's offices and exam rooms in there. Prior to that, on the right over here, there's a medium-sized meeting room, and it's more of the executive boardroom for private meeting functions for the physicians and for other physicians and healthcare providers within the community. It's kind of like a branch meeting room for all of the Brant healthcare system. It's tied into it. On the left side over here, we have some openings which will be future windows into the courtyard. So we'll have a really nice experience of the natural light in the courtyard and the views of landscaping. The hopes for the center is that it becomes a primary healthcare hub for Brantford. The interim site is very successful, and it's been in operation for 3 years, and it's gone through its own expansions because the programming has been so very successful. This site, the main site, is 18,000 square feet. It's about 6 times the size of the interim site, and so we're confident that we've planned enough space to care for future growth of the success in the programming of primary health care in Brantford downtown. Oh, one of the really, well, there's lots of exciting things about this is that, one, it's urban rejuvenation and infill and repurposing of buildings that have been used for a variety of uses, right from McCutcheon Bakery at the turn of the century up until the 60s, and then it changed various hands into a pawn shop and things like that. It's repurposed into a building for the community and for the health of the community. There are several buildings that are part of the campus of the main site, and we've joined them all, and in as much as we could, we're trying to expose the building interiors to show the heritage of the building and the qualities of what it is in various parts of the buildings, as well as the courtyard, the heart and soul of the plan of the building. It's on Colburn Street. It will get a lot of attention, and there's a direct relationship we think is very healthy for primary care for those in the heart of Brantford to be on Colburn Street, the direct access to it as a neighborhood hub for healthcare.